Good morning, everybody. And again, I want to say to the first responders, thank you for what you do day in, day out. The hospitals, the doctors, the nurses, everyone, thank you so much. And the administrators in all the buildings and the people that are the backbone of the hospitals and everyone that's out there, thank you, thank you, thank you. And to the people that are social isolating, thank you. People that are paying attention and doing what they're supposed to be doing and trying to adapt to this new world we're in, thank you. But unfortunately, this morning, we have two more people that passed away. Both males, one in their 70s and one in their 60s. The one in the 60s with underlying health conditions, the one in the 70s we're not sure of yet. But that brings our total up to 16 families, and my heart and condolences goes out to the two families that had their loved ones pass away last night, and again to all the families. And you know, like I said before, just imagine losing somebody, but losing somebody when you can't visit them in the hospital, you can't see them, you can't say your goodbyes. And if you're not paying attention how funerals are done now in wakes, it's no one's allowed. No one's allowed but immediate family. So it's a tough time all around, and our heart sadly goes out to the two families and to everyone. As of today, that brings our total up to 499, up 24 from yesterday, of positive cases of the COVID-19. And it brings us up to 677 people under mandatory quarantine. That's up 38 from yesterday. And under precautionary quarantine, that's 77 people, and it's actually down. So, that's a good thing. Yes. Yesterday, like I said, there was 475 positive cases. Today, there's 499. And there are now 35 people being hospitalized with a hospitalization rate of over just 7%. It was 8 yesterday, so that's down a percent. And 13 adults that are in ICU. That's down from yesterday also, which is also good news. We're seeing more testing being done because of Albany. They were shut down. But thank you to Governor Cuomo and his team that has brought the testing back with everyone working in a partnership. And I can't thank the health department enough, and Liza and her team and my team especially, to making this happen. And hopefully tomorrow we'll be announcing some other initiatives that we're going to be taking starting Thursday in this community about mobile testing for communities that can't get out there. So stay tuned for that, and hopefully we'll have a great announcement tomorrow on that. To get into areas that don't have transportation or have to rely on transportation like buses or Lyft or Ubers or cabs, and we've addressed that issue. So tomorrow we'll have that great announcement. Again, I can't thank Albany enough and the president there and everyone involved for helping us out with this, and the governor. And again, my heart goes out to the families. And it's a sad time in our history with people passing like this, and it's a new norm that we have to get used to. But it's hard when you take phone calls when someone passes away. I don't like to see that happen to anybody. Again, my heart goes out to the families. Dr. Whalen.
Good morning. So as the county executive mentioned, our cases are going up because of the amount of testing that we're doing in the community. The center at Albany has enabled us to start to get a better handle on where the numbers are in our community. Before that was established, what we were seeing really was extremes. So we were seeing patients that were hospitalized, and we were seeing healthcare workers. And this gives us a better sense of how the disease is presenting in our community. The data is early, but we are finding cases that are asymptomatic in some circumstances. And asymptomatic spread, we are learning, is thought to be a significant portion of spread of this disease. So we are learning about COVID-19 on a daily basis. Some of the information that I may have imparted to you in earlier press conferences may in fact be contradicted because of what we're learning. And part of this really is about asymptomatic spread and the importance of wearing masks. So early on, the belief was that asymptomatic infection was not necessarily the driver of infection. We were going on what we knew about other viruses and about people transmitting that carry high viral load. Generally, you can appreciate that in someone because they seem acutely ill. With COVID-19, we are seeing people that look fine, look just as normal as you and I look right now in terms of not having any symptoms. And these people have COVID-19 and they are spreading COVID-19. So this is why it's important that we consider the governor's directive on essential workers wearing masks or face coverings. We know that surgical masks and face coverings are good tools for source control. That means they protect you if you have the virus from spreading the virus to others. So for all those that are currently considered essential workers, that will be a helpful tool for them. In terms of protection, wearing a surgical mask is not completely protective. Full PPE, full personal protective equipment for coronavirus includes an N95 mask and a face shield and other things like gowns and gloves. If you are conducting direct patient care, those are important, and those tools that's why we reserve that PPE for our essential health providers. But wearing a surgical mask can help you filter some of the droplets that you may be exposed to in the air if you become in contact with someone with COVID-19. So the importance of these masks shouldn't be understated, and it's something that we've discussed repeatedly at these conferences. We don't know the full extent of how homemade masks can protect others, but they are felt to be a somewhat protective tool in that they can filter out some of the infectious material. And again, they are thought to be helpful to those who may be asymptomatically infected or infected and wearing them. So those are going to be important strategies going forward. We've seen our numbers go up, and we, as the county executive mentioned, are committed to ensuring that all members of the Albany County community that want and need to be tested can have availability to the test. We are getting a lot of questions on demographics for our tests. You know, can you give proportions of people that are affected by race and ethnicity? And it's very important when we look at those numbers to know that the data that we represent can only be a reflection of the data that goes in. So if we are only testing a portion of the population, the data will not necessarily represent what is truly going on in the community. The best way to represent what's truly going on in the community is to have equity of testing and to be able to test across the county in all levels. So this is something that we're looking forward to being able to do in the coming days and weeks. And as that data comes in, it will definitely be more meaningful to represent what's going on in the community. So as that comes in, we're looking forward to creating a platform that's currently being finalized to share that with county residents on our webpage, and I'll be announcing that hopefully in the next couple of days. The first data that we'll get will be reflective of the testing that we have been able to do thus far, and as I said, I think it will become more meaningful as we get more data in the weeks to come. Thank you.
Thank you, Dr. Whalen. I totally echo what you're saying. It's one thing that we said is very important is to pinpoint where this is, where it's at and who's affecting more versus other population, and we can only do that by doing wider testing and get into communities that aren't getting the testing done for a variety of different reasons, and we are addressing that issue, and I look forward to that announcement shortly too. On the other hand too, we have a different norm, and that's our schools. And for the parents that are out there that are now learning how to homeschool, that know how challenging it is now for our school teachers and our principals and our superintendents out there that do this year-round. welcome to their world and to the new norm of how school is being taught, not just through elementary, through high school, but through college now. Going online, doing things differently, and getting to do things differently outside the box. So it's been challenging. It's a lot of frustration for parents to be home. It's been hard for the school districts to change and do a 180 from the way they've been operating. But who better than to talk about this but Dr. Marie Wiles, who Guilderland School District was the first one to be shut down here in the Capital District, and unfortunately has been shut down the longest and probably has gone through all them hurdles and bumps and everything else. So Dr. Wiles.
Well, thank you so much, Mr. McCoy, for inviting me. I'm just going to start by saying I vividly remember my phone ringing at 4 a.m. on Friday, March 13th, when I received the call that we had a student who tested positive for COVID-19, and our world changed immediately. We closed school on that day and spent the day gathering the names of students and faculty and staff who may have come in contact with that individual so that we could do, so the Department of Health could do the mapping and the tracing of the contacts for that individual. So we've been at this a long time. A lot has happened in a month. We transitioned to remote school like all of the school districts around us, initially to keep folks engaged in learning in more of a review and let's just keep engaged and hopefully we get back to school soon, but clearly that has changed. We've been out for a long time, and Guilderland and all of our neighboring school districts have transitioned to new learning. So students each and every day are logging into their computers or opening packets of materials to engage in new curriculum until we get that sign that we can go back to school. So it is a challenge. I have said many times to my colleagues and my peers at Guilderland and around that we have recreated school out of the ether. Every single system, every single way that we operate, we've had to rethink in the last month. I could not say enough about not only the work of our own faculty and staff in Guilderland, but across the region, there has been tremendous leadership in having school districts work together to solve some of these unanswered problems and to coordinate curriculum and to share teaching resources. The Capital Region BOCES has been instrumental in coordinating the work among 23 school districts, and that work has been shared across the state. SUNY Albany, the School of Education, has put together a tremendous repository of resources for teaching and learning. So the resources have materialized in remarkable speed. They are high quality, they are engaging. They're not the same as being at school. So I also need to do a tremendous shout out to our parents who are now juggling all kinds of things at home. Some of them are working their own jobs from home. Some of them have their own children who they're trying to keep engaged with the work that's being sent to them each and every day. Some of them are essential employees and they're going off to work and they're hoping that someone is making sure their children stay engaged. And so we all recognize that this is an uncharted path, and we're ever so grateful for everyone's making their best effort to make this work and to be safe. So it's been quite a journey. And I guess I should also mention that while we're doing this, we are still continuing to feed children. We're up to 42,000 meals delivered to needy families just in Guilderland. And so I'm sure that number is into the millions if you think about the entire county. So thanks for that.
Thank you, Dr. Wiles. Thank you for that update. And, you know, thank you to everyone that's been stepping up and doing things differently in to the school districts and turning this around quickly so kids can continue to learn, because we don't know when everything's going to open up. And I commend the governor working with the other 4 governors to look at a plan to open up. I know that's a bunch of questions I get every day. I will say this to people that send us the emails or Facebook questions. It's hard. We are trying to predict how to open up. When can we start bringing workers back? And I know we're looking at mass testing before they open it up. And I've been working with Steve McLaughlin, my counterpart in Rensselaer County, the county manager and chair in Schenectady County, and we've been talking about the same thing about how are we going to get back to opening it up. And the reason the numbers, and like I said, I think Dr. Whalen and I have said this the most since the beginning of this, our numbers would have been a lot higher if we were testing more. And with this more testing going on, the numbers are going to go up. But we plateaued because a lot of people are listening to the message of staying home and social isolating and not doing the right things. So you're making that surge or the APAC for the hospitals be able to deal with it because people are doing the right thing. So thank you. But we don't, it's still here. It hasn't gone away. We're just dealing with it better. And, so we're taking guidance from Governor Cuomo and his team of how we're going to do this in the coming weeks. And I've gotten that question over and over. Here's my prediction. I keep saying this. We probably won't be back to the norm to July or August. I'll be surprised if school districts open back up again for the remainder of the year. And I'll be surprised if we're up and running by the 15th of May. I would love it to sit here and tell you differently, but that's why I said this is a marathon, not a sprint. Take a deep breath, people. It's the new norm. And we'll get through this. And we'll get through this staying calm, cool, and collective. But on the good news, I want to commend Governor Cuomo. He delivered us a ton of PPE, so thank you to the Governor Cuomo and his team, to Mike Morris and everyone else that I've been working with. I can't thank you enough. I appreciate it. It's going to be much use. We're going to need this for, so thank you, thank you. I also want to thank Lowe's for donating 2,000 boxes. So Lowe's came in and dropped off 2,000 boxes for quarantined families. So thank you to Lowe's for everything that you're doing. And United Way for making it happen. Again, working with United Way has been a great partner. Also, I always like to remind everyone, our mental health line, our people are available 7 days a week, 8 a.m. to 8 p.m. The number is 518-269-6634, 518-269-6634. Please, they're there for you. Any questions you may have, and also the 211 number and the New York State hotline number, and to OTB and everyone else, thank you so much. And I do want to again thank the Laborers 190, Anthony for seeing it, for putting the truck out. It's going to be in certain areas where people aren't keeping the social distance. So maybe it's a truck that has it's an electronic sign on it, and it flashes different messaging about keeping the 6 feet separation, wearing masks, coughing into your arm, and to remind groups of people that are still not paying attention. Please, I don't want to call out the neighborhoods, but you drive around, you'll see it in certain areas, and we have to educate better. So I want to say thank you to everyone, and again, my heart goes out to the two families.